I think recruiting the next generation is going to be a challenge that I'm really excited about, but we're going to have to innovate and do some new things to recruit and train this next generation. Specifically focusing on our college programs that train our new professionals is going to be one area that I think will be successful. All of us have a history of coming to Sophe, I think, through a connection to another professional or to a faculty member. So embedding faculty ambassadors in each of our programs in our academic settings will be helpful. But then I think we have to really create an innovative and engaging environment at our conferences, in all that we do. This history project with some of the more innovative modalities for presenting information is a great example of what we need to be doing. So I think we're up to the task and I'm excited about it, but we are going to have to be more mindful of the need to engage and entertain our audience as we recruit that next generation.
I would see Sophe and NCHEC continuing to work on efforts to promote the quality assurance of practitioners in the health education profession, continue to promote the awareness of the profession of health education, and any efforts to improve our nation's health.
Another focal point for my leadership will be attempting to enrich the relationship between Sophe chapters and the Sophe National Organization, and looking at ways that the Sophe chapters can grow, increase membership, and increase their activities.
I think some of the challenges both for Sophe and health education is how to ensure that we are constantly responding to changing priorities on the national and global landscape.
The students that are coming on board, those are the next leaders of Sophe. And how do we get them engaged early on, get them so that they start to create that next generation of what this conference looks like, what that journal looks like.
Working on the behalf of large constituencies that are not part of corporate America, there are challenges. The challenges are largely defined in part, I think, by resources. In the case of Sophe, I don't think there's any lack of capacity in its membership. I think we've been very fortunate to have very strong leaders for a long time at Sophe.
Future directions. Well, I'd like to see a lot more health education in the school.
A third focal point is a very specific type of professional development, and that is to help health educators move into higher level leadership positions. We're planning to start this with a session at the 2016 conference that will be intended for university faculty members who have aspirations for higher level leadership positions in higher education, positions such as associate deans, deans, provosts, and so on. And so we'll eventually expand that to community and public health educators who are working in health departments or for various types of health-related agencies, so that we'll be setting the stage for health educators to move into higher level leadership positions, so that there will be a health education presence in the decision making, and there'll also be a greater recognition of health education.
I think we ought to consider building tools on the website that people could contribute to. For instance, we've seen this in a number of different places, but I think it would be perfect for Sophe to do this. You could build a tool on the website that would let people who have any device that counts steps, so they could submit their steps and we could track how long it would take Sophe members to walk around the world. I think we should also consider the use of new approaches to member connection. I think that we ought to set up SMS texting of updates. I also think that there's something to be said for utilizing the technologies that we're also already using. For instance, Twitter, Sophe tweets. And each year, the conference sets up a hashtag for the conference. But as far as I know, we've never actually used those tweets to tell a story. There's also something else that I think we ought to consider, and that's to use data analytics beyond simply website analytics.
We've yet to put our pedal to the metal with regard to actually going after a more global audience. So when we do get ready to do that and do it in a strategic way with our website, with our knowing what membership benefits are going to be valuable to people outside of the US, I think we have great potential to even have a greater sphere in working with organizations like WHO and making an impact on a global scale.